Hello, I'm Dr. Zaid Fadul. Today I want to talk about a side of Alzheimer's care that's rarely discussed openly, but is all too common in hospitals and homes: the family battles that erupt when a parent develops dementia. If you're an adult child of an aging parent, especially one with Alzheimer's, you know the stress can bring out the best and sometimes the worst in families. I've seen it countless times. Two siblings carrying the daily weight of caregiving, only to have an estranged brother or sister suddenly ride to the rescue, challenging every decision, often out of guilt or unresolved family issues. These moments can tear families apart just when unity is needed most. Today I'll share with you why this happens, what you can do to protect your loved one, and why planning ahead isn't just smart, it's essential. Let's be honest, Alzheimer's doesn't just affect the person with the diagnosis, it shakes the entire family tree. Siblings who haven't spoken in years suddenly find themselves at the same table, making life or death decisions for a parent who may not even recognize them. Why do these fights happen? Sometimes it's about money, sometimes it's about guilt, and sometimes it's about old wounds that never healed. The child who lives closest often becomes the primary caregiver, feeling overwhelmed and underappreciated. The distant or estranged siblings, meanwhile, may feel left out or guilty for not being there, so they swoop in determined to save their parent, often by blocking hard but necessary decisions. The truth is, these conflicts aren't just about today's choices. They're about decades of family dynamics, favoritism, and unresolved pain. The stress of dementia care just brings it all to the surface. I've dealt with these family dynamics many times in the hospital, and it's always difficult for everybody involved. Here's a scenario I see all the time. Two siblings have been managing mom's care for years, making tough calls about safety, finances, and medical needs. Suddenly, the estranged sibling, who's been out of the picture, reappears. Maybe they live far away, maybe they've been absent for other reasons, but now they're back, and they're questioning every single decision. Why does this happen? Often it's guilt. The rescue sibling wants to make up for lost time, but instead of helping, they disrupt carefully made plans, sometimes even threatening legal action or calling adult protective services. This isn't just frustrating, it's dangerous. Delays in decision-making can put your loved one at risk. And the emotional toll on primary caregivers is enormous, leading to burnout, resentment, and sometimes even estrangement between siblings that lasts a lifetime. Family conflict doesn't just hurt feelings, it can have real, lasting consequences for your parent. When siblings can't agree, care decisions get delayed. Sometimes nothing gets done at all. The parent may be left without the care, safety, or comfort they desperately need. I've seen families end up in court spending thousands on lawyers instead of care. I've seen parents move from facility to facility because siblings can't agree on what's best. And I've seen caregivers, often daughters, burn out completely, feeling abandoned by their own family. The sad reality is everyone loses when families fight. The parent suffers, the caregiver suffers, and even the rescue sibling rarely finds a redemption they're seeking. The only way out is through honest, direct communication, and most importantly, planning ahead. Here's the most important lesson I can share. The time to make big decisions is before a crisis hits, when your parent is still able to communicate, sit down as a family, and talk openly about their wishes. These conversations are tough, but they're a gift to your parent and to every sibling involved. To help you navigate this, here's a simple roadmap you can follow. 1. Schedule a family meeting. Bring everyone together in person or virtually, and make sure all voices are heard, including those who live far away or are less involved. 2. Ask the hard questions. Who does your parent trust to make healthcare decisions if and when they can't speak for themselves? What are their wishes about resuscitation, feeding tubes, or other life-sustaining treatments? What kind of quality of life do they value most? I personally know how hard this conversation is. I've had it with my own folks and with many of my patients who trust me with their families. It's difficult, but it's necessary, and I promise you, everyone will feel better once they've made the right choices for the family member involved. 3, put it in writing. Establish a healthcare power of attorney or HPOA so there's a clear decision maker if your parent becomes unable to speak for themselves. Discuss and set up a financial POA to handle money matters. Complete advance directives to document their wishes for end-of-life care. 4, share and communicate. Make sure everyone in the family knows what's been decided and where the documents are kept. I personally like using a Google Drive, and I find this works really well. Keep the conversation going. Update plans as your parents' wishes or health change. If possible, have the patient make a video message clearly communicating their wishes. As our loved one slips away, it's natural for all of us to want to hold on tighter and not let go. I've seen videos like these have profound impact on everyone involved. 5, get professional help if needed. Don't hesitate to involve a lawyer, social worker, or care manager to guide you through the paperwork and family discussions. The earlier you take these steps, the smoother everything will go, no matter how complicated your family dynamic might be. Planning ahead isn't just about paperwork, it's about honoring your parents' wishes and protecting your family from unnecessary pain down the road. Open, direct, and consistent communication is your best defense against family conflict. Don't leave anyone in the dark, even the estranged sibling. Regular updates, group texts, or monthly video calls can keep everyone informed and reduce suspicion or resentment. Check out my book review on nonviolent communication for better insight on how to communicate through difficult situations. If you're the primary caregiver, document decisions and share them with the family. If disagreements arise, consider bringing in a neutral third party, a social worker, geriatric care manager, or mediator to help guide the conversation. Remember, the goal isn't to win the argument, it's to honor your loved one's wishes and ensure their safety and dignity. When everyone is on the same page, even if it's not perfect harmony, your loved one gets the best care possible. Dementia care is hard enough without family drama. If we fail to plan, we're really just planning to fail. I've seen these sibling battles time and again. It's akin to a civil war in the family, and trust me, everyone loses. The best way to protect your loved one and your own peace of mind is to plan early, communicate often, and put the right legal protections in place. Establish a healthcare POA while your parent can still make decisions. Decide on resuscitation status and other end-of-life wishes as a family. Keep everyone in the loop, even if it's uncomfortable. And don't be afraid to ask for help from professionals, support groups, or trusted friends. Most of all, remember, you're not alone. Every family struggles with these issues. What matters is how you respond by facing the hard conversations head on, honoring your parents' wishes, and supporting each other through the challenges ahead. When dealing with estranged siblings, I know it's very easy to dehumanize the other person. But I want you just to remember this one point, that that's their father or their mother too. And it is wounding them very deeply, whether or not you realize that. It doesn't matter how they're acting on the outside, it's what's going on inside that really matters. So take a moment, take a breath, and recognize that it's their mom and dad that they're worried about. Thank you for watching. If you found this video helpful, share it with your siblings or anyone who's walking this difficult road. Let's break the silence around family conflict and dementia care and make sure every parent gets the dignity and support they deserve. I'm Dr. Zaid Fadul. Take care of yourselves and each other.